Imagine using light, I mean, just specific kinds of light, shining it on your body, and it could maybe melt away fat in certain spots, but also at the same time, kind of reboot your cells, like
Yeah.
boost your whole system from the inside out. Sounds a bit sci-fi.
It really does. But, the science behind it is actually incredibly specific. So today we're digging into materials from a Bodi Sculpting Training Academy.
Okay.
We're focusing on two, well, pretty cutting-edge non-invasive treatments that use light. Red light therapy, you might also hear it called photobiomodulation or PBM.
Right, PBM.
And then there's laser lipolysis or LL.
Gotcha. So our job today is to really break down how these actually work, right? Because they both use light, but they sound totally different.
Exactly. We need to separate them clearly.
Yeah.
PBM seems to be about deep cellular healing, system-wide benefits.
The healer.
Yeah, the healer. And LL is much more targeted, aiming for that physical body sculpted.
Sculptor, okay. So healer versus sculptor. Let's unpack the science here.
Absolutely. And the key difference really comes down to what inside your body is actually absorbing that specific wavelength of light. It's very tuned.
Okay, let's start with the healer then, PBM, red light therapy. It's often like a whole body thing, right? You sit in front of panels, it's relaxing, quick sessions, maybe 10, 15 minutes.
Yeah.
But it's doing more than just feeling nice and warm. What's the core thing happening, the molecular action?
Right. This is the fascinating part. PBM is like a precisely tuned frequency, and its job is to sort of chemically unstick the engine inside yourself.
Unstick the engine, okay.
Yeah, so we need to talk about the mitochondria, the power plants of the cell.
Right.
When cells get stressed or just older, the mitochondria start making too much of this molecule called nitric oxide. And
Hang on, nitric oxide, I thought that was generally a good thing. Like, it helps blood flow.
Well, yes, in other contexts, like blood vessels, it is helpful. But inside the mitochondria, it causes a specific problem. Think of it like a sticky note covering up a keyhole. It competes with oxygen. It basically blocks the receptor site, a protein called cytochrome C oxidase. Let's call it the oxygen door, where oxygen needs to bind for the cell to make energy efficiently.
So if this sticky NO molecule is clogging the oxygen door, what happens then? The cell can't breathe properly, essentially.
Pretty much. Oxygen can't get in and bind like it should, so the whole energy production line gets gummed up. Even if you're breathing perfectly fine, the cell itself is starved for energy.
Wow.
And this leads to what's called oxidative stress, which, is linked to inflammation, cell damage, even potentially triggering disease processes down the line.
Okay, that makes the light's job sound critical then. How does shining red or near infrared light actually fix this cellular traffic jam?
It's remarkably elegant, actually. Those specific wavelengths, red and near infrared, are absorbed specifically by that oxygen door protein, the cytochrome C oxidase.
Only that protein.
Primarily that protein.
Yeah.
And that jolt of light energy causes the nitric oxide, the sticky note, to basically just pop off. It dissociates from the protein.
So the light physically knocks the NO molecule loose, just shakes it off, clearing the way for oxygen.
Precisely. The oxygen door is unblocked. Oxygen transport goes back to normal, instantly. The cell's energy factory restarts, and ATP production, that's pure cellular fuel, just skyrockets.
Ah, okay.
The cell goes from being stressed and energy deprived to being optimized and, energized.
That sudden boost in ATP, that must be why the list of benefits we saw in the source material is so broad. If you fix the energy problem in the cells, the effects ripple outwards, right?
Exactly. It really covers a huge range. I mean, for pain and healing, the sources mention things like better tissue repair, relief from general aches and pains. But what really stood out were the claims about systemic issues.
Like what?
Things like helping with fibromyalgia symptoms, chronic fatigue syndrome, even some kinds of autoimmune arthritis pain. That's pretty significant.
Yeah, that goes way beyond just a surface treatment. And what about physical performance or appearance?
Well, for athletes, it's suggested as a tool for both preparing muscles before an event and speeding up recovery afterwards from workouts, injuries, even surgery. And then cosmetically, that cellular energy boost is thought to help rejuvenate the skin from within, improving tone, elasticity, maybe reducing the look of lines, scars, wrinkles.
Okay.
Plus, systemically, more energy often links to better mood, better sleep, maybe even feeling sharper mentally.
Right. But it's important we note the sources were clear. For weight loss specifically, PBM is described as something that helps or augments weight loss, but only when you're also doing the diet and exercise. It's not a magic fat melter on its own.
Absolutely. Key distinction.
Yeah.
PBM is the systemic tune-up, the overall health optimizer. It's not the targeted fat remover.
Okay, perfect transition. Let's move to the sculptor. Laser lipolysis, or LL. This one is targeted right. If PBM is the system-wide tune-up, LL is like a focused beam aimed at specific fat pockets.
That's a great way to put it. LL is defined as non-invasive, uses these paddle applicators, and they emit a very specific, low-level laser energy. The sources pinpoint the wavelength, 635 nanometers to 650 nanometers.
Okay, 635 to 650 nanometer. Why that exact range? What makes that special for fat cells?
That frequency seems to be the sweet spot. It can pass through the skin safely, but it gets preferentially absorbed by the fat cells themselves, the adipocytes.
Ah.
But here's the key. It doesn't destroy them, not like liposuction or some other methods. Instead, the energy gently heats the fat cell just enough to stress its outer membrane.
So, unlike PBM's chemical change, this is more of a physical effect on the cell wall.
Exactly. This heating triggers a signal inside the cell. It tells the cell to break down its stored fat, the triglycerides, into smaller components, free fatty acids and glycerol.
Okay.
And here's the really neat physics bit. The gentle heating also causes the cell membrane to develop temporary holes, or pores. They call them transient pores.
Transient pores, like little temporary drain holes.
Yeah. Exactly. The cell itself doesn't burst or die. It just opens up these little pores, shrinks down, and releases the liquefied contents of those fatty acids and glycerol out into the space around the cell.
Wow.
It's kind of mimicking what your body does naturally when it needs to tap into energy stores. And crucially, because that wavelength is so specific, the claim is it doesn't really affect or damage the surrounding skin, nerves, or blood vessels.
Okay, that clarifies the how really well, but it raises a big question for me. If LL doesn't actually kill the fat cell, it just shrinks it. Is it permanent, or is it just like temporary deflation? Couldn't the fat just come back later if you eat badly?
That is the crucial question with these kinds of non-invasive treatments. And the training materials we look at are very upfront about this.
Okay.
That released fat, the fatty acids and glycerol, it goes into your lymphatic system. Your body needs to process it and ideally burn it for energy. If you don't use it, then yes, the body is perfectly capable of storing it again, potentially right back in the same cells it just came from.
Ah, okay. So laser lipo basically gets the fat out of the cell, but you still have to get it out of your body. The sources actually mentioned exercise after treatment, didn't they?
They stressed it. Essential was the word used, I think. You've released the fuel. Now you have to actually burn the fuel.
Right.
A 30-minute LL session followed by hitting the couch with snacks probably isn't going to give you the results you want. That post-treatment activity is key. This is where good practitioner advice comes in.
Makes sense. And speaking of practitioners, since these materials are from a training academy, it's probably worth mentioning the credentials behind it. The trainer who developed this stuff wasn't just winging it.
No, definitely not. They listed things like a Certificate 5V in Training and Assessment, and Advanced Beauty Therapy Diploma, even a diploma in clinical nursing skills.
Okay, so that suggests a certain level of seriousness and understanding of the body, not just the machine.
Right. It speaks to the standard they're aiming for in training people on how to use this tech responsibly. And that includes the logistics, which seem built around that metabolic need.
Like the timing between sessions.
Exactly. Treatments are usually spaced about 72 hours apart. So 3 days, typically done twice a week.
Why the 72 hours? Is that for the lymphatic system?
That seems to be the rationale. Give the body enough time to process the released fat from one section before hitting it with more. Avoid overwhelming the system.
Right.
The sources suggested like a package of maybe 6 to 8 sessions as a typical starting point for seeing results. But people might need, say, 10 rounds or so to reach their goal.
Okay. This brings us to the business side and the really important caveats. The sources talked about salons offering memberships, maybe combining PBM for the systemic boost with LL for the targeted sculpting. But alongside that, there's always the disclaimer, isn't there?
Always. And it's vital for anyone considering this to understand, as the sources state clearly, like with pretty much any non-surgical, non-invasive treatment, results cannot be guaranteed. They will vary, sometimes significantly from person to person. That's just the reality.
It's definitely not a magic wand then.
No. So many factors played a role. Your individual lifestyle, your diet, your exercise habits, any underlying medical conditions, even your age. All these things can affect, if you get results, how good the results are, and, critically, how long they last.
So the tech might provide the push, but the body's overall condition and habits really determine the outcome.
Exactly. It's a catalyst, not a cure-all.
Okay, so let's quickly sum up the core difference again, based on the science we've dug into. Two light therapies, but totally different jobs.
Right. Red light therapy, PBM, is fundamentally about cell chemistry. Using light to fix that nitric oxide traffic jam at the oxygen door, boosting ATP energy production system-wide. Think healing, function, optimization.
The healer.
The healer,
Right.
and laser lipolysis, LL, that's more physics, meets fat storage. Using a specific wavelength, 635, 650 millimeter, to create those temporary pores in the fat cell membrane, forcing it to drain its contents for later metabolic removal. Think targeted sculpting.
The sculptor.
The sculptor. Both use light, both non-invasive, but worlds apart in how they work and what they target.
So the big aha moments, really. PBM is fixing the machinery inside the cell by chemically nudging a molecule off a protein.
Unblocking the energy pathway.
Well, LL is physically changing the cell membrane just temporarily to let stored fuel leak out.
Precisely. Liquefying and draining.
Well, we've certainly taken a deep dive into how these two technologies work, looking at the distinct science behind them. It really is pretty amazing how specific frequencies of light can trigger such precise biological effects.
It is.
Yeah.
From the mitochondrial level right up to visible changes in the body.
Definitely. And, thinking about how targeted light can influence these deep internal processes like cellular energy or fat release, it leaves you with a final thought, doesn't it? Something for you, the listener, to maybe mull over. Well, if light, which is just electromagnetic energy, can be tuned so precisely to affect our internal chemistry, what other, maybe less obvious environmental inputs might be doing the same? Things like specific sound frequencies, or maybe even low-level electromagnetic fields we encounter every day. Could they be subtly changing our internal chemistry right now without us even realizing the specific mechanism?
Huh. That's an interesting question. Definitely food for thought.
We'll leave you with that one. See you on the next deep dive.